Well, good afternoon, everybody, and welcome to you all. I'm Owen Clark, BBC Wales health correspondent, and I'm very happy to be able today to chair this very important discussion happening at a time unlike any other ahead of an election, which I think it's safe to say will also be unlike any other. Now, the video we've just had an opportunity to watch really does hit home, doesn't it? The impact the past year has had on so many things, not least on the NHS, social care and staff dealing with a once-in-a-century pandemic, but also not forgetting the families who faced so much heartache. But today, largely, the focus will be on what happens next. Now, whoever will be the next health minister in the Welsh Government will have a lot to think about and a lot to do. The challenge perhaps just as substantial as what's come before. Now, the phrase doing things differently is one we've heard a lot. Now it seems there's no other option. Now, I'm very glad that we've got here today representatives from the three main parties whose portfolios are health. Vaughan Gething will be here for Labour, Angela Burns for the Conservatives, and Rhun Iorwerth for Plaid Cymru. And we'll have a public panel too, with a wide range of perspectives, asking questions later on. Before we start, as usual, we've got some procedures to go through. If anything goes wrong, it's not the fault of the organisers or the technical team. It's probably my fault because this is the first online discussion I've chaired, so please be forgiving. Everyone is on mute unless they're participating. Vaughan Gething, we know, has to leave about 4:10, so unfortunately we won't be able to take questions from the wider audience, but as I mentioned, we will have questions from public panel. Nevertheless, if you do want to share your comments, please do so using the Q&A facility. And the Bevan Commission's Deputy Chair, Chris Martin, will be summing up some of those feelings at the end of the discussion, reflecting the comments you post. And they will also be instantly shared with the politicians. So please feel free to join the conversation on Twitter using the hashtag doing things differently and tagging at Bevan Commission as well. Now, as I mentioned, this is the third in the series of discussions that have been organised by the Bevan Commission and delivered in partnership with the NHS Confederation in Wales, Social Care Wales, and the Board of Community Health Council in Wales, as well as the Institute of Welsh Affairs. And the previous sessions have looked at the bigger picture, the impact on the NHS, the impact on many other things through a variety of different lenses. But today, as I mentioned, this is an opportunity to ask the politicians what they think needs to be done to secure health and care in Wales for the future, and what should be done differently, perhaps. Perhaps we'll get an opportunity to shine a light on some of the commitments in the upcoming manifestos. We'll wait and see. And as I mentioned, we'll also be bringing in a public panel with a wide range of perspectives to ask their questions afterwards. Now, before we begin, I'd like to introduce the Bevan Commission's chair, Professor Samantha Iorwerth, to tell us more about what the Commission does and why today is so important.
Welcome to the third of the Bevan Commission's Doing Things Differently. Over the last few weeks, the Commission has brought together people together to raise awareness and discuss the tough decisions we have ahead of all of us and how we all have to work together to make the changes needed. The Bevan Commission was established over 12 years ago by the then Minister for Health at the Welsh Government to provide an independent and expert source of advice and guidance on health and care matters. It does this by drawing upon the advice and expertise of its 24 internationally renowned Bevan Commissioners, all of whom give their time freely to support the Commission's work. These include key leaders from the fields of health and care, industry, academia, local government and the third sector. The Commission has produced over 40 publications during its time, with wide-ranging topics covered. Among them, Prudent Healthcare set out 4 important principles which now underpin Welsh health policy. These have been further tested and reinforced during the COVID crisis as being fundamental to ensuring the best and most appropriate health and care for those in greatest need. The Bevan Commission is not just a standard think tank, but one which also uses its influence and expertise to drive change and translate its thinking into practice through a wide network of Bevan innovators. Our vision is one of fairness, sustainability and equity, where everyone has a part to play in maintaining their health and well-being and those of those around them. We recognise that the NHS cannot achieve health and well-being alone. That's been well demonstrated in this current pandemic. We all have a part to play, and we must welcome and praise the outstanding commitment that the health and care staff, plus others, and the people themselves have made across Wales and are continuing to make during this pandemic. This is why we sought to recognise them, all of them, in our publication Above and Beyond campaign. The Bevan Commission hopes and aspirations for the futures must be that through adversity we will come out of this stronger than we were when we went in. We must therefore grasp the opportunity to do things differently and more prudently. I'm looking forward to hearing from our politicians on what their plans are and what they wish to do differently. By taking full advantage of the new ideas and innovative ways of working, maximising the use of technology as well as the powerful influence of people in all of this, we will once again be the envy of many around the world. Like our predecessor, Aneurin Bevan, who set up the NHS just 2 years after World War II with great leadership, courage, ambition and commitment, we can do the same. We must ensure that Wales has dynamic, fair and integrated health and care and community services that are fit for the future ahead. We all have a role to play in this. Thank you very much, and I wish you a very good meeting. Thank you.
Diolch yn fawr iawn, and thank you for that, Sir Mansell. Next, we'll be hearing from the partners of the Bevan Commission organising this very important Doing Things Different series, the board of the Community Health Councils in Wales, the Welsh NHS Confed and Social Care Wales, and they will give us a sense of what they want to see done differently.
Last year, the Welsh NHS Confederation published our key calls for the Senedd elections on behalf of our members, the NHS leaders in Wales. Our members are clear that NHS in Wales is on the right road, but to achieve a health and social care system that effectively addresses the challenges of today and the future, we need commitment from all political parties in Wales to work together and to recognise that supporting the health and well-being of the population is wider than the NHS. The pandemic has shown what cross-sector working can achieve when all parts of the system unites. The speed and the scale of transformation we have seen has been amazing. Our election calls put forward a vision for health and social care that supports people to stay active, healthy and independent in their communities. We're on a journey to transform the health and social care system and to deliver the vision we set out in our election calls briefing. To achieve this vision, we need commitments from the next Welsh Government to implement a government-wide national programme and engagement strategy to support the public to live healthier lives, to introduce social care services based on individual needs, to support a multi-professional workforce whose own well-being is prioritised and promoted, to develop a 5-year investment plan in service change to reshape the NHS estates and infrastructure, to think innovatively about the new service models and harness the potential of digital technology, to introduce governance arrangements to drive cross-sector change and to deliver the outcomes that really matter most to the people of Wales. We will continue to represent the views of our members in the debate, and we look forward to working closely with all the political parties and the candidates over the coming months. Thank you. Diolch yn fawr.
My hopes for the future include thinking about the social determinants of health to address the inequalities that have been exposed during COVID. My second hope would be better understanding by citizens of the role of social care in helping people with dignity, safety, independence and well-being. My third hope would be to build on the joint work that we've seen during the pandemic to break down those professional and organisational barriers that often get in the way of a good service. And then finally, I think we need to ensure continued investment in social care and health to meet future needs and to improve parity of esteem with the NHS.
Throughout the pandemic, the 7 community health councils in Wales have been hearing from people and local communities about the things that matter most to them about their health and care services and what they want to see in the future. Here are the main messages. People want easy access to health and care services delivered in an integrated way, as close to home as possible. People want a system that places equal value on physical and mental health and well-being, and particularly supporting children and young people where the impact of the pandemic has the potential to be long-lasting and wide-ranging. Throughout the pandemic, we've heard most of all about its impact on people waiting for diagnosis, care and treatment. Waiting times in many services were too long before the pandemic, and the aim cannot be to get back to where we were. It must be more ambitious than that. Previous ways of tackling waiting lists will not work this time around, and creativity and innovation is going to be key to tackling backlogs. Some things have worked really well for people during the pandemic, and these need to continue into the future. Digital healthcare is the most obvious benefit for many people, but not everyone, so it must sit alongside face-to-face care and treatment. We have also seen how people and organisations, including the third sector, can work together so effectively in partnership to meet the needs of people and communities. This needs to be continued and further developed. Designing sustainable health and care services for the future is going to be different to how it's been in the past. It must tackle the inequalities highlighted so clearly during the pandemic, and it must be done with people and not done to people in communities across Wales through continuous engagement and consultation. We look forward to playing our part in tackling the challenges we face together.
Well, obviously plenty of food for thought there to get us started, and I'm very glad to report, and it's always good to report, that we've now got the full complement of our political panel with us. So I'd like to welcome Rhun ap Iorwerth from Plaid Cymru, Angela Burns from the Conservatives, and Vaughan Gething for Labour. Now, you can read all about them in the welcoming pack, but in the briefing pack, but I think we'll agree they're quite familiar faces. There are three specific questions I think this session needs to cover, and I'll ask one question to each of you in turn, if that's okay. Around 3 minutes max for the answers, so we need to kind of stick to that. So snappy, as always, is best. So let's start with you, Vaughan Gething. Obviously, you've had to make a lot of tough choices during the past year, to say the least. Moving forward, what do you think the tough choices will need to be made? What are the tough choices that will need to be made in responding, recovering, and refocusing from COVID-19?
Well, I think the first and the biggest tough choice is that you have to understand all these choices are still bounded in with the pandemic, because it won't be over magically by the end of the first week of May. And the health recovery plan won't be easy, because as you've heard in the introduction, it is the case that we can't return to old ways of working. That means that you've got to both try to have a sustainable system that can deliver against the need that comes in. You've also got to deal with the backlog, and the balance is in wanting to press on with activity when we've got exhausted staff and we're going to need to take care of our staff as well. And that uncertainty means that the requirements of the pandemic, the increased infection prevention control, the PPE requirements, greater distancing, that will prevent greater activity taking place straight away. So the backlog will actually get bigger when we go into the next Senedd term as well. So I think that any new minister, whether it's me or somebody else, has got to be prepared to give some national direction into the system. We've got lots of ground-up innovation, but I think a minister is going to need to make some choices on endorsing new ways of working or requiring them. And that means a preparedness to reform what we have. Not all of our staff will always welcome new ways of working, and the public and politicians of all parties often mourn the loss of what they have had, rather than focus on the opportunities to improve outcomes by changing what we have. That means both buildings and models of care. Lots of our estate isn't really fit for purpose. We invested lots in primary care, built a new hospital with the Grange. It's been a big part of the pandemic response, but actually getting to a point where people accept the need for that change isn't simple. That's also the case with contract reform, of course, as well, with our primary care partners too. And population healthcare, I think that is one of our big challenges. It requires other people outside the health service to be part of it. You need partners, not just in local government and housing, the voluntary sector, but the world of work being such a big factor. And the final thing I just want to get over is that in the pace of change, one of the difficult things is that is a moment that won't last forever. There is going to be a moment of opportunity at the start of the next term where you don't lose sight of the person, the staff and the public, but actually, you've got to be really determined at the start of the next term to potentially make some difficult decisions. The final thing I'll just say is, for all of us, it's much easier to describe the range of challenges than to do it. It's actually really hard to make this happen whilst balancing all of the competing demands of keeping our system going. But there are a range of the challenges that whoever sits in this metaphoric seat, as opposed to my physical seat, will have to address after we get into the next Welsh Parliament.
An almost perfect 3 minutes there, Vaughan Gething. Angela Burns, same question to you. Tough choices, obviously. What exactly are they?
Tough choices, but also some extraordinary opportunities. I think that we need to recognise that there's been some outstanding work that's been undertaken in the NHS and throughout social care in the last year. And what we need to do, the biggest opportunity we have, is to try to bottle that extraordinary attitude, that ability to cut through the bureaucracy, to make things happen and preserve it. And that is actually a tough choice, because the easy choice would be to allow things to gradually slip back to the way they were, to bring in all the processes we always used to have, and those invisible walls that stopped different parts of the health and social care organisation from really hanging together really well. So we've got to bottle that, keep it, and make it continue. And I've already been, I've talked to quite a few health board chiefs, and they say that, they can see that change is hard to maintain, and we have to do it. If you want an absolute tough choice, I think one of the toughest choices is to be honest with the public. People have to know that we're still in a really difficult situation. They have to understand that we are fearful for an additional wave. They have to understand that the choices that they make, the lives they lead, there are all factors in how well they are able to look after their health. And we have to say to the public, this has got to be a partnership. You cannot just leave it to the NHS or to social care. It has to be a triumvirate between both and you, the person, to really maintain your social care. And those are tough choices. That I tell you what, that's a tough conversation politicians don't want to have to do, because it's not a win. But it's one that is absolutely vital that we should do. We need to streamline the NHS to cut through that bureaucracy. We must make the choice of enforcing data and technology through the system. Both Vaughan and Rhun will know it's one of the things I've banged on about quite a bit, that I find it immensely frustrating that our health system is so disjointed, and that there are issues between one part and the other part, even being able to get simple things like patient records transferred from north to south in an easy way. We've got to use the technology. It's outstanding what's out there, and it can make such a difference. We have to stabilise and develop social care. We have to recognise the profession at all levels. We have to bring forward equality and levelling up measures. And that is a tough choice, because that's going to take money. And when you talk about money, your biggest and toughest choice of all is, where do you get that money from? And the money's never ending. It's not end. The money has a finite end. That means we have to make tough choices about where that money comes from. And finally, it's about ensuring that our existing staff are supported. And again, that can be a tough choice, because it's about prioritising them over something else. But without these amazing staff, we will not be able to make any of our tough choices ahead of us.
Thank you, Angela. Rhun, nobody doubts there are tough routes ahead, or there's a tough job ahead, but I want to bring it back to tough choices, something that you will have to decide yes or no. Can you elaborate on your views about choices? Oh, I don't think we can hear you, Rhun.
Let's try again then. Very good afternoon to you.
There we are.
With a bit of volume. It's not a meeting without you're on mute.
Fantastic. The choices.
I could hear you. It's okay. In many ways, the tough choices that we're faced with now are the same tough choices that we faced prior to COVID, but they've been amplified even more. And we've had a whole heap of new problems added to the ones that we had before. To me, the challenges are around dealing with an even more acute set of problems, the backlog caused by COVID, whilst at the same time transforming services and building more joined up, more resilient and more sustainable services. And we can't say, well, let's forget about the transformation for now. We've got COVID to deal with. They've both got to happen. So there are, outside the realm of health and care, there are tough choices about public spending. And it's important to mention that, there are those of us who argued for a long time that austerity, cuts in the last decade were a political choice. I think that's probably been proved during this COVID pandemic. Let's not start talking the language of cuts and austerity now. We're constrained in Wales, of course, by the fact that we don't have our own treasury that we would as an independent country. So we need to keep pressure on UK treasury. But then we have to make those tough choices within around prioritising within our own budgets. And again, there has to be a clear and relentless focus, I think, on maximising funding available for transformation. Investing in those things that will improve lives and save money in the long run too. And then there has to be finally a preparedness to do things differently, to integrate like we've never done before, to innovate like we've never done before. And that shift in thinking is a challenge in itself that all of us, whichever party we're from, really have to engage with like never before.
Thank you very much, Rhun. I'm going to work backwards for the next stage if I could, because, okay, we always talk about transformation, and for years transformation has been talked about in terms of needing to do it in the health service. But from my experience doing this job for a number of years is that transformation is an incredibly difficult thing to do. Now, the pandemic might offer an opportunity here. Can I narrow it down to what you will be offering the people of Wales in the forthcoming campaign? And to start off with you, Rhun ap Iorwerth, your manifesto, how will it address the challenges that are so apparent now?
A few years ago, before I came back to the health brief, I had a bit of a sabbatical in economy and transport for a while before coming back. Di Lloyd and Helen Mary Jones set up Applied's Care Commission that did really, really good work and put forward a very, very well thought out set of recommendations that have been proved during the COVID pandemic to have been incredibly, incredibly important. And they would have been the backbone in many ways of our manifesto, but now, after the experience of the last year, they very much form the backbone of that manifesto. Finances, of course, we're confident that we have a set of figures that will allow us to deliver this. We can talk more about that in the weeks coming up to the election. But in terms of the content, one, the preventative, transforming attitudes towards the preventative, allowing people to live more independent lives, keeping people healthier, keeping people within their communities. That has to be a real priority of mine personally, outside my brief in the Senedd. But integration is so important that we can't just allow it to sit there and say we all want it. It's a holy grail for all of us. We will create a national health and care service. That is how serious we are about seamlessly integrating the two. It doesn't mean wholesale reorganisation of the health boards or local government. It doesn't have to be like that. It's having national frameworks that allow us to deliver clearly and consistently to people in all parts of Wales a joined up approach to health and social care. That, to me, will allow us to transform the delivery of health and care in Wales. It means bringing the workforce together, creating pathways through health and care for the workforce, terms and conditions being put on a par, parity of esteem for those within care and health. I think getting that right will put us on a very, very firm platform to having the kind of sustainable services that we need.
Thank you very much, Rhun ap Iorwerth. Angela Burns, your opportunity now in terms of tangible policies you will be offering to deliver, rather than aspirations, rather than goals. What will they be?
Yeah. In March, April, May, June of last year, I held a series of stakeholder roundtables, I think with almost every organisation within the health and social care sector, and we discussed what they needed. Why? Because I am not somebody who works on the front line in either the health boards or in the social care. And we wanted to hear what people really needed. Two things came out of it, if you were to summarise it all: funding and people. So the first thing we will do is we will be enshrining in law an NHS covenant that will, under statute, increase the amount of funding in the NHS in real terms year after year during the next Welsh Parliament. We hope that that will go some way towards answering the funding question. In terms of workforce, and that's incredibly important, and it doesn't matter whether you're talking to the RCN, Royal College of Occupational Therapists, or to a residential home or a domiciliary care provider, actually being able to have a workforce that you can use to provide the support and services to the people is vital. We have a very strong policy: recruit, retain, retrain. And it is an apprenticeship, degree-based recruitment policy that will encourage people to come in at whatever level they are comfortable to, into social care, into the healthcare, and to be developed as far as their skills and their career aspirations will take them. We are funding it. It's apprenticeships. It is pay as you earn. Or learn as you earn. There's a whole raft in that, and that is another clear policy. We have a NHS Hospitals and Buildings Recovery Fund, because it doesn't matter whether you're a GP in primary care or you're a hospital in Carmarthen, you need that support to help build your facilities and your infrastructure. You know, we talk a lot about integration. We talk a lot about the need for that. That's a chimera that's been very difficult to achieve over the years, and if you talk to the experts, they say that it is not something to be underestimated. So whilst we will be working in the background on some of the big ticket items, up front now it's about funding, and it's about bringing in not 10, not 20, not 100, not 1,000, but thousands of people into the health and social care arena to help provide the services for the people of Wales.
Similarly to Vaughan Gething, then, obviously you've been in a position of making policy in recent years. If you were the next health minister, what would the policy you would be implementing immediately? What will be in your manifesto?
Okay, so I'm not going to give specific details of the manifesto today, as you'd expect. We're going to launch a manifesto, you'll get details then, but you can expect that to address workforce in health and social care, and that'll be, of course, on the background of building on our successful recruitment within this term and successive above inflation investments in training new staff in health and social care. There won't just be a pledge on doctors, it'll be about our whole workforce to look at what that needs to look like for the future. And then you can also expect us to talk about mental health, about the expansion and the need to address the significant increase in need that we know we're going to see for children, young people and adults. And again, how we continue to take forward that integrated approach, not just with education, but more widely than that. You can expect us to reinforce not just the NHS recovery plan, but the planned care recovery as one of the central tenets that we accept that frames our manifesto offer as well. You can also expect us to talk more about continued integration with partners in local government, especially, but also our work alongside housing and the voluntary sector and the directly related links between those areas of activity and good health outcomes. You can also expect to hear us talk about the future of social care, and I was pleased to hear both Angela and Rhun talk about the future of social care in the last two questions, because that is one of our big challenges, and we're going to need to find some common ground in the next Welsh Parliament term to agree not just how we organise it, but actually how we fund it and what better looks like. And the final thing is not really about the manifesto, it's about the first question in this one. And, you know, we talked about tough challenges, and yet actually, will the manifesto reflect lots of what we're saying today of any party? Because at the start of this term, we had a parliamentary review to set out the need to do things differently, what better looked like. And that set out some difficult choices. And then for understandable reasons, difficult choices don't generate universal support. That's because if you're in opposition, it's your job to scrutinise the government. That's part of the deal. But actually getting through to say we will need to do things differently, that will mean reorganising the way the service works. You won't find those detailed plans in a manifesto, but in terms of doing the job, an awful lot of that will take up the time of whoever the next minister is to make sure that happens. And so, you may not expect people to lead with their chins in the manifesto in terms of here are all the difficult choices that I'm committed to making. But there's an awful lot of that we required of people, even if it doesn't generate perhaps lots of votes and headlines.
Thank you very much. And apparently, I am told there's lots of discussion already on Twitter, so we must be doing something right in this discussion. But just before we move on to the next stage, I know the tragedy of all of this can't be underestimated, of course. But Jerry, just very briefly for you three, is this an opportunity that just has to be seized now? We've seen what the NHS can do. We've seen what it can achieve in a matter of weeks or months, which may have taken many years otherwise. For the three of you, are you really framing your thoughts now in terms of the tragedy, yes, but the opportunity now that this massive event has for the future? Very briefly, all three of you, if you could, starting with Vaughan.
Yes, and some of that is by necessity, because the challenges we have, you can't go back to an old way of working. If you look at what we have done, the fact that we had different ways of meeting people remotely, and that was rolled out across the service within just a few months, that would have taken years to have done previously. So that can-do attitude can carry forward, but it's not a moment of opportunity that will last forever. So yes, I do think there is an absolute necessity to seize the opportunities that exist now, because people have had to work differently during the pandemic. There's a willingness amongst many staff to do that, but also, I think there's a large expectation that this will be what the future could and should look like. And I don't think you'll find that there's much difference in outlook from the three of us. It's really about how we can take advantage of that and what our respective priorities will be.
And then Angela, briefly.
Yeah, very much the same. And I mentioned it earlier, and I think that's really important that we maximise the lessons that we've learned, that we've cut through so much red tape, so much bureaucracy. We've still had governance, but we've made stuff happen. And this is the other big thing at Owen, I think for the first time for a long time, the public really feel utterly connected to their NHS and their social care. And we need to maximise that connection. We have to build on it and say, listen, this is a three-legged stool and you have to play your part, and have those tough conversations with the public and bring them with us and make sure that everybody shapes our future together for health services.
And Trine, I suppose you only need to look at the development of vaccines and innovation and so on to see what momentum a crisis can bring. Do you think then that momentum at least should not be lost?
Yeah, this has affected lives at such a deep and intense level in our community, more so than ever in these past few days. I've just been to the end of the road today in my Llangefni Rugby Club top to pay respects to young Hugh Gething on his final journey. There's a momentum within the health and care services, as seen most graphically, I guess, through that vaccination program, but also in the sheer unselfishness and willingness to go the extra mile of everybody who's worked so hard on the front line. But there's a realization among the public of what it means to us to have care and health and care services. An understanding that they need to be paid for and invested in, and a recognition that transforming them and putting our shoulder behind them at every opportunity is a job for all of us. So yeah, it's a moment that has to be seized.
Okay, thank you very much. We'll move on now. And again, I stressed I'd love you to be really snappy and really concise with this one, because we're talking about specifics. It's not quite a yes/no answer, but I really want to try and nail down some concrete pledges from you here. So starting with you, Angela, if you were the next health minister, the top three things that you would be on your to-do list.
The top three things would be to bring social care firmly into the fold of health and social care. You know, we talk about the NHS all the time. We need to talk about social care far more. We would be looking to level up, to bring parity, to bring support, training, professionalisation, a minimum social care wage. My second priority, mental health. I think if nothing else, this pandemic has really brought home to us the importance of mental health, from the youngest of the young to the oldest of the old. We need crisis centres, we need proper support in the home, we need a recognition that mental health plays as vital a part in health and well-being as being able to walk and do any of the other physical treatments that we need. Thirdly, it would be about re-empowering and streamlining our services and actually driving out that bureaucracy, driving the decision-making and the money down to the front line, where the people who actually have to do the delivering have the capacity, the capability and the empowerment to do the delivering. Because when you look across the piece, there are so many excellent, outstanding pockets where people are already working across all fields, delivering comprehensive integrated services to people, making it happen. But those great big, those green shoots never get the chance to flourish and spread throughout Wales. And that's what I would be concentrating on.
Vaughan Gething, obviously you have a to-do list every day, no doubt, but the top 3 things as a next administration you would do?
Well, starting point is the overarching reality of the pandemic. We just park that and accept that that's going to be there, whatever happens, dealing with the end of the pandemic. The first thing for me is the commitment to change and reform for a purpose. We won't recover as fast as our staff and the waiting public need us to if we allow barriers to change to be re-erected. The scale of the backlog and the reality of that will increase the need for further reform for a purpose in both mental health and physical health, and indeed the continuing integration with social care. The second thing is that focus on public health and healthcare inequalities. That's both about investing in public health protection measures, which we're doing some of, but that'll need to carry on in the next terms. It's also about shifting attitudes and supporting people to live healthier lives. And the pandemic has highlighted the cost we pay is not evenly shared. And then the third point, it goes beyond that, is the public engagement in their own choice. It's not just about public health. It's about how to have persuasive conversation with the public on a range of different areas, and about it being in their interest to think about doing things differently, to engage differently, as opposed to telling people you have to do this differently. And a good example is end-of-life care. End-of-life care, there's been lots of people experiencing end-of-life care under terrible circumstances in the last year. As a country, we don't talk about end-of-life care very much at all. It's hard to get people to engage in it right up until it's about to happen, or after it's happened. Then people are upset if a loved one has what they consider to be a poor end-of-life experience. And actually, that is about getting people to engage more in the choices they make and the choices we need to make alongside them. So I don't think it's just a matter for public health and inequalities.
Thank you very much. And can I just encourage the audience to ask your questions on the forum, because they will be forwarded to the politicians subsequent to this event. Rhun, I know you've probably heard this before in a previous life. You have 3 points to make in about 3 minutes. What are the top 3 things that you would do?
Just making some scribbles here. I think the 3 would come under the sort of general umbrella title of transformation in the post-COVID context, because, it's, as I said, it's those 2 things. The 3 things: workforce, number 1. I think we have to really move up a gear when it comes to the recruitment and training and retention also of the workforce. You've heard of me talking of the need for 1,000 extra doctors, 5,000 extra nurses under the health professionals. That's as important as ever. We need to crack on with increasing the workforce in order to make health and care more sustainable, and also bring care staff onto the same terms and conditions as those in health through that integration that I talk about. 2, preventative. So important to me, just in terms of principle. Where I'd like to get to in terms of sustainability is that we can spend health budgets on football fields. So we're creating a fitter, a healthier society. We're not at that point yet. There's a lot of money to be spent within health and care itself, but we need to get the preventative right. That's at the heart of everything that we do in transforming the population as much as the services. And the third one is innovation, and innovation takes a number of forms. Yes, innovation and better use of technology, digital, and other sort of IT-based technology that we really have to utilize better within health and care, but also innovation in the way that we deliver things. And to me, the main innovation that I want to deliver is on that creation of that seamless national health and care service.
Thank you very much, Rhun. Excellent. And we are sticking to time miraculously. And it's a good thing that is, because it's not me that's going to be asking the questions now. We'll broaden out the discussion and bring in members of our public panel. Can I once again ask the audience for comments? Otherwise, if not for anything else, Chris Martin will be struggling to fill at the end without a few of your comments. And I don't want
Chris
to
Martin never struggles to fill.
I don't want to put him in that position
I agree,
anyway.
because I know Chris too. You're right.
But as I said, let's broaden this discussion. You will see the biographies of the members of the panel in the briefing pack. But let's turn first of all to Jared. Jared Thomas is an Aberystwyth student, a biochemist. His dissertation is on sepsis and alternative treatments, which makes it very interesting in the context of this discussion. But he's also a member of Hywel Dda Community Health Council. What I'll do is I'll get Jared to ask the question first, and then get each of you to answer that question in turn before moving on. Even more snappy now, please. Around 2 minutes max for each answer. So Jared, fire away.
Thank you. So, as a young adult and student, the situation last year was very different to years previously, and differences continue this year, from primary schooling right up to higher education in Wales. These changes will have impacted an entire generation, in addition to a cohort of university students. What will your party do to support the generation going forward?
Who wants to kick off on that? Shall we go for Vaughan to start off with?
Yeah, and I think this is really challenging, Jared. So it's very easy to say we'll do anything and everything you need, but actually it'll be about trying to understand what different parts of our groups of children and people need. So the return to education, face-to-face education for schools and colleges from the 12th of April is really good news for them and their families. And yet actually we've got a generation of people at university like yourself had an entirely different experience. I'm Aberystwyth alumni, and I would have had a very different experience in my time there to the one you've had in this last year. And it's about not just the sense of justice about can you give people money back, it's really about what can we do for your future experience. And actually the mental health and well-being of students is actually a huge part of what makes university a challenge for some people, but also it's quite a protective environment for most people. Being with people broadly your own age going through a similar experience is actually a real positive that comes from university. So I think there's an awful lot to do, and that some of that is actually about listening to the experiences of children, young people and students themselves, and understanding what matters to you. And again, the honesty that's been talked about today of what can we do, and what are things that we can't do, but how that support isn't just a one-off. You can't say there'll be a summer school to help people catch up and that's it. Because actually life doesn't work like that for lots of our children and young people, whether you're 7 years old, 13 years old or 20 years old and at university. So I think the listening will be important. You'll already be aware of some of the steps we've already taken to improve support around mental health and well-being for young adults at university. And I just think this is going to be one of those big challenges we carry on and on into the future. It's why the investment we're making in Tier 0 and Tier 1, the early support and integrate and an intervention in mental health will be really important. But it also comes into the outside health of the jobs market as well, to make sure we've got an economic future to look forward to, which is why a pandemic response is so important, to make sure the workforce isn't scarred for a significant period of time.
Angela?
Yeah, thanks for that, Jared. It's a really topical question, and it is interesting that the Welsh Youth Parliament It is their top priority. They debated it only a few weeks ago at the Senedd, and they are very alive and have made us politicians very alive to the whole issue of mental health and mental health resources within schools, colleges and universities. My party have pledged that we will ensure that there are mental health services in all of these facilities, because I don't actually believe that young people do not have a rosiness to them, and I think that if we can support young people now, actually that they will come back from this. There's an awful lot of talk about the fact that will young people be able to move on? Will they be able to cope? How will they catch up? I have great faith in our young people, and listening to the Welsh Youth Parliament, I think that faith is there in absolute bucketfuls. But what we need to do is give you guys the tools to be able to access them whenever you need them in a place that's comfortable for you, to help you to realise the issues you'd like to discuss, and to find closures and support to move on. And if we can provide young people with those tools, then I actually am thoroughly confident that young people will be able to pick up those batons, if you like, and move forward. And that's what the Youth Parliament say quite loudly and quite clearly. But it's about making the funding available and getting the workforce in place that is there to provide those tools for you. And that's what my party will commit to do.
And Rhun, finally.
Hi, Jared, and best of luck with the rest of your work at Aberystwyth. I think one of the main things we have to recognise is that we don't yet know what the impact of this pandemic will be. We have to understand how it has impacted on children, young people, young adults, and let you take the lead on this, which is something that's quite pertinent in the year when we introduce voting at 16 for the first time. We have to listen to our young people, and I've seen it already in my own three children. One still at school, two now at university age. The impact of this pandemic on them has changed a lot over the past year. There have been periods of different uncertainties, of various lows, and we don't know how that's going to change over time. So we have to be very acutely aware of measuring through young people what is happening. There'll be very practical things that need to be done. It'll be more important than ever that training and education is supported for young people, many of whom will find some doors in the short term will have been closed to them because of the economic impact of COVID. But on that sort of mental health side of things, you might have heard us talking about our plan to set up a network of calling them youth welfare hubs, based on a model that we've seen working really well over in New Zealand. And these are sort of high street, sort of town centre hubs that people can feel confident that they can turn to immediately for help, largely with mental health, but also with other things that are associated with being young and the challenges around smoking cessation or sexual health or whatever it might be. We foresee maybe 14 of these around Wales. I'd love it to be more over time. But so I think bringing services that are explicitly for young people into the heart of our communities is something that I'm determined to deliver.
Thank you very much for the three of you. I won't ask you, Jared, to rank the answers because that would be completely unfair. But are the politicians in the right ballpark from your point of view, very briefly?
We are certainly moving towards the right ballpark, but I suppose that there's always more that can be done to support people across the age spectrum, from both young people even to older people who may have now longer standing mental health problems, who may need for perhaps society reintegration if they've been shielding for the last year. Since it's nearly been a year since they've been shielding, so it's quite important to see the whole spectrum of age, both young and older adults that may now be suffering to socially reintegrate to the community.
There we are. Thank you very much, Jared. Let's move on now to Barbara Chidgey, Bevan advocate and chair of the Daring to Dream charity. Welcome, Barbara. Fire away with your question.
Thank you. Many patients of all ages present with multiple comorbidities and require treatments from a range of different clinical specialities. Well, as one such patient, I can tell you what it can feel like is at times, clinically I'm talking about now, there's a bit of me over there, there's a bit of me on a different floor in a different clinic, there's a bit of me in a different location, and all over the place. Now, this feeling as a patient experience, I suppose I'm saying, it's reinforced because I'm frequently being advised, oh no, I'm sorry, Barbara, we only deal with this particular bit of your body in this clinic, and you'll have to go and chat to another clinician team about another bit of your body. And actually, but all these bits are me, they're the complete me. So my question to all of you as we move forward, what are your suggestions, please, about how we move forward on a holistic clinical coordination of the medical needs of huge numbers of patients like me with comorbidities, including all of our many long COVID patients? Thank you.
Let's start in reverse order from before with Rhun.
Thanks for the question, Barbara. Angela and I were taking part in another session yesterday evening, and we had a similar question, but based on dementia specifically. And the questioner said, she was going to different agencies and failing to pin down where the help that she wanted would come from. I mean, to me, it comes with the kind of integration that I'd like to see happening. I think it's building on good work that's already been doing in the recognition of the importance of multidisciplinary teams, especially within primary care. I think there's more that can be done on that, and for that we need the strengthening of the workforce that I was referring to. Also, I think the development of sort of diagnostic centres will be another very, very important part of that innovation in bringing multidisciplinary teams together under one roof that are able to address the different facets of problems that people present with. And I think probably long COVID is a really good example of this. I was talking to Long COVID Wales, a new organisation, a couple of weeks ago. And they were describing how difficult it is to identify that kind of holistic care for long COVID, because long COVID is something that presents itself in so many different ways. And currently, yes, there's some signposting that's available, but a lack of joined up care that people can, when they present themselves to primary care, presumably, primary care can then refer them to a centre, to a service that can look at a range of issues and bring them together in identifying what problems might be. So again, it's workforce, it's integration, and it needs money, but it needs people more than anything.
Angela?
Can I give you two answers, Barbara? Or chop your question into two. So the first bit is the bit when you're in hospital. What we need is a more holistic attitude towards the patient. The patient is not on an assembly line with your arm here and your leg there. You are you, and you need a holistic review. And what we sometimes see is what we call the revolving door syndrome. Somebody goes into hospital for one thing, comes back out because that thing's mended, but in the meantime, something else has gone wrong because they have comorbidities and they're back in again. And this is what we have to stop. This is why people like orthogeriatricians are so important, because people go in for slips and trips, hips and knees. But actually, while you're there, an orthogeriatrician looks at everything else, ensures, your cardiovascular, pneumonia, all these other things that actually can wipe people out because they've gone in for that one they've not been looked at. That takes a sea change in thinking from the medical profession, and one that we just need to encourage. Over the years, the medical profession has specialised more and more and more, because actually that's where the centres of excellence are, and we understand that. But by bringing in sort of people who cover a wider spectrum, like say orthogeriatricians, we can actually start to sort of, if you like, ameliorate that. The second part is wraparound care. So this is, you're out of hospital now, you are back home, you need wraparound care, and that's the policy that we have developed. And this gives you the opportunity to have everybody who would be involved, from, you know, maybe it's occupational therapy, chronic conditions nurse, palliative care. It's about siting, using primary care, community services properly, taking that kind of stuff out of the hospitals and delivering it locally. As Rhun said, you know, it takes money and it takes workforce, and that's why, you know, I talked earlier about our recruit, retain, retrain policy, about getting more people in. But that's what we've got to aim for, because everybody wants to be treated where they feel more comfortable, where they feel the safest. Usually it's in their locality, from the home, and they want to be able to deal with all of the people who need to have intervention in them without having to just go off to a hospital for one particular thing. All right, Owen, I've taken your hint.
Thank you, Angela, very much. Vaughan Gething.
Thank you, and good afternoon, Barbara. And I think you're basically asking us, you know, how will our health and care system see the whole person, and not just have people working in entirely different and separate strands, or what claims to be a unified organisation. And on that, I think we have made some progress, but it's not perfect, and there's more to deliver. And your example of long COVID is a good one, because you can't give someone the label long COVID and say, aha, we know which box to put you in. Because actually there'll be people who have long COVID who will have different impacts. They'll need to see different people to help them with their support. And that's why so much of this needs to be coordinated through primary care. You know, those specialist generalists, as they're often called in general practice, are part of what helps to make our system work. They shouldn't be seen as gatekeepers, of people who can understand the broad treatment that people need and to try to make sure it is coordinated. Now, that isn't just the responsibility of primary care clinicians, it is our whole system working together. And I know that the Welsh Ambulance Trust have been a good part of seeing more of this happen, where their skills are used, not just their staff working in primary care, but seeing the journey that a patient takes, and how at each stage it matters to that person where they're going and how that is related to the other parts of their treatment. That's why we go back to the comments earlier about listening to the person, because often you are the best expert on what is happening. You may not have all the medical knowledge, but actually to know that you've got different strands of treatment. Now, I'm an outpatient in 2 different departments, so I do regularly ask about the different things that are happening. I've been with the NHS looking after me for some years with those conditions, so I see it on a personal level as well as a policy one. And actually, these choices come every day. So I spoke at the start of the day at a Welsh seminar on regulation. So different regulators being drawn together, some of whom are in Wales, Social Care Wales, others who are UK-wide. And we were talking about how the pandemic has really forced the pace of change and integration, and the regulation has had to take account of that. So you haven't got regulators doing entirely different things in different areas that could end up splintering the care that we've had to bring together. And the final thing, I say this just because I noticed, like me, that you're a glasses wearer, I made a choice in the future of eye care today as well. And there's lots more we can do about moving that care into the local sector, into our high street optometrists, and the work that they can do to prevent you needing to go somewhere else if you have eye care treatment needs. But that is often linked to other healthcare conditions. You know, the way people lose their sight is often not just because of a challenge in their eyes. It's often about a range of other conditions that go into sight loss, potentially being part of what happens with and for them. So there's quite a lot that we've done, but the pace of change still needs to improve and get better, quicker and better to meet the needs of the whole person.
Thank you all, and thank you, Barbara. I won't ask you to come back in on this because I know time is slipping away and we've got 2 more questioners to get through. But I'm sure if you want to, you'll be able to give your analysis of those responses in the kind of forums that we have, and the politicians can read them afterwards. Could I now turn to Sujatha Thaladi of Mentoring, a charity that with its HQ in Buta, I think, that is involved in mentoring young people from various communities. Your question, please.
Hi. There are many longer-term health effects of COVID-19 infection. How are we equipped for such cases? And also, we know that there will be a huge increase in mental health issues due to lockdown, loneliness, isolation, shielding, uncertainties, and bereavement. How are we going to address this, or how are we addressing this currently before it gets too difficult to tackle those issues? Can you please expand on your previous comments, please?
Yes, the legacy of COVID, of course, will be something that decision makers and the NHS will be grappling for a long time. Angela, let's start with you this time.
Yeah, do you know, so that was a really difficult question actually to answer, because there is no easy answer. I mean, let's be clear, we're going to have loads of people with mental health issues because of COVID, whether they've suffered it themselves, whether they've lost somebody who they adore because of it, whether it's because of the isolation, because of just being locked down through the pandemic, whether it's because they're at home with their kids and their kids have driven them nuts, you know, whatever it may be. There will be communities that are very resistant to asking for help, don't want to engage. And although we all say the same kind of things about reaching out, about improving mental health services, etc., I come back to the one fundamental: staff. We do not have enough people, and the people we have, to be honest with you, are probably on straps by now, because they have all worked so hard to get us as far as they in the last year and a half. So I can talk to you about the fact that, you know, we want of mental health, that we have a whole programme for improving and providing mental health services. But, you know, if I was the health minister tomorrow, it would still take me months, if not years, to get all those people in place. I've got to find them, recruit them, train them, build the facilities for them and stick them in it. You know, it's a long, long haul, and all we can do is say that because of what we're learning now, because of what we've seen, and because of the new shape of, you know, the way society will have to be next month, in a year's time, in 2 years' time, you know, we've got to learn the lessons now and start putting in place all of the facilities that we need to go out and reach people who are in those hard to get communities, go out and reach women and children who find it very hard to open up, go out and get to the men who, you know, don't ever want to go and talk about anything that's really deep and personal. You know, give people that aspiration and that hope, but it takes people, and that's what we don't have. We have a lot of great people at the moment, but we don't have enough, and the people we have are exhausted.
Rhun, concisely, if you could, would help us out. Again, the long-lasting legacy here.
Yeah, I think it's on two different fronts. One, the physical effects of suffered from acute COVID. I think there's more support for that now. But then there are the less clear symptoms, longer lasting of long COVID. If you haven't been particularly ill at the time, perhaps from COVID, I think that's one where there really needs to be a moving up through the gears. I think especially there's an inequality depending on where you live in Wales. Here in the north, there's hardly anything, it seems, for sort of that kind of long COVID currently. And I think that's about recognising that this is something that needs investing in. On mental health, we're in a better place on mental health now than we were a few years ago. We're talking about mental health. There was a time when it just wasn't talked about. So we have come a long way in some ways. But I still remember, you know, the early days of this pandemic when nearly 1,700 patients, mental health patients in the north of Wales, were told, "Are we going to have to take you off the waiting lists and you know, go to see your doctor again when this is all over?" Now, it was all a mistake, and they said, "Oh gosh, no, that shouldn't have happened." But the fact that somebody somewhere thought it might be okay to tell somebody who wanted mental health care that, you know, for the time being we've got something more serious to deal with, you know, brought home a message that there's still some way to go in investing in the kind of mental health services that we now recognise we need, but still need to deliver better.
Thank you very much, Rhun. And Vaughan Gething on that. And I'll come to you, by the way, Vaughan, first for the next answer, because I know you are pressed for time and I've got commitments. But on this particular question about, you know, long COVID and the like.
Yes, thank you. Thank you, Sujata. I should just make clear, Butetown is in my constituency, so I know Sujata and her organisation, but I know lots of people will as well for the work that they do. And look, this development of long COVID isn't just long COVID, of course. The mental health impact of coronavirus, as Angela, I think, has said, is for all of those people who have been related. If you've seen people come to harm, if you yourself have come to harm, if you've recovered fully, if you got long COVID and the risk of serious and significant recurrence, but also the broader impact on mental health and well-being for how we've all had to live our lives. And it's one of the harms we actively consider with all of our choices. And for the future, actually, we've got to think about the impact on our staff that we're already seeing, because the things that they have seen and had to do to keep us safe will affect our staff and their ability to work with us and for us for the future as well. For some staff, that impact is already here. For others, it will kick in after a further delay. And the other group we wanted to highlight in terms of this, the impact on health, mental health and well-being. We talked about children and young people earlier, but actually, the world of work is so tied up in how we feel. It's tied up in healthcare inequalities as well. And there are people who have already lost their jobs and probably more people who will lose their jobs. And the impact of significant economic harm means we will always see a rise in need in the health service, including mental health need as well. So we know we're going to have significant and increased demand. We've already taken some evidence from this in Public Health Wales, and that's informing choices Aline Ed Morgan, the Mental Health Minister, is already making. So that's why I referred earlier to investing in earlier intervention and support. And that won't just be delivered directly by the health service. An awful lot of that, as you'll know, Sujata, in the sector, there'll be voluntary sector support that will need to work alongside, because if we don't do that, we won't have the capacity to expand out the support we're going to need. And again, this comes into what is essential, not a nice to have part of the service. So greater partnership with the voluntary sector, greater partnership that recognise that often the volunteers are closer to people and will often be people who are trusted and seen in a way that a medical professional sometimes isn't. And that whole point about stigma and the ability to have a conversation. We've done quite a lot on this in the last few years in Wales with a whole range of different movements, but I think actually we're going to need a really significant scale up to address the challenge that I'm afraid we all know is coming, and it will take years and years to resolve this and work it through. But by the end of it, this is the positive, I hope we'll then be in a much better position as a country and our willingness to talk and to recognise these challenges, and that the stigma that we've all talked about will, I hope, be a long way further back. But as ever, it's never perfect. There'll be more for us to do.
Thank you very much, Vaughan, and thank you to Sujata. Could I bring in the final question? And it's Arfon Jones from a part of the world that's very beautiful, and I know quite well, Nevin. Croeso, Arfon. Your question, please.
Diolch fawr. Having been a GP for 25 years, the biggest hurdle I have in caring for patients at home or facilitating a safe and timely discharge from hospital is the lack of social care provision in our communities. Is it not time that we started paying our home carers a decent wage? We need to give them a defined career path, and we need to empower them by upskilling, thus kind of mitigating this tendency they have to leave the profession because their pay is better in the local supermarket. And as an add-on to that, we don't have an integrated IT system in this country. Isn't it time we had one that whereby primary, secondary and social care were able to talk to each other? As it stands today, I have no idea what the other sectors are doing for my patients on a day-to-day basis. Hasn't really been touched on much in the discussions this afternoon. And lastly, Welsh Assembly Government has encouraged us in primary care to work closer with social care sector, which we've been doing very successfully in Nevin as a kind of pilot. Isn't it time that the Senedd did something differently, and you as politicians had a cross-party statutory body to work on a collaborative health and social care vision for the next 20 years? Because I'll bet you any money that in 20 years' time people will still be getting ill and they will still need social care. Thank you.
There we are, Vaughan Gething. Quite specific questions there about fairness, about IT and technology. Go ahead.
Well, thank you, Arfon. I've actually been to Nevin. It is a lovely part of the world. I went there with my family in the summer when we're able to travel and move around. So great time on our day in Nevin. Look, on your first point about social care and its impact, I've been chairing an interministerial group, and I'm going to make a statement before the end of this term on the outcomes of that work. So we'll have something to say before we get to the election about some of the challenges and some possible options for funding social care in the future. And we'll definitely have something to say about the workforce. But I think it's good news that the three main parties are all going to be saying something about social care in their manifestos, not just about saying we think it's important, but I think we're all going to have something to say about the future financial set and what that'll mean for staff, and then the quality of care that those staff provide. Now, we may come up with slightly different formulas, but I think it's good that we're all going to be saying something significant about it. We'd be in an even better place if there was a UK-wide settlement, because lots of this is tied into how you fund it and what the UK-wide settlement on tax and benefits is as well. So I think we can still make progress in Wales, even if there isn't going to be UK government action on it, despite a raft of green papers and the Dilnot Review and everything else as well. I can't tell you exactly what that is now, because I'm not going to pre-release the manifesto today. We had a contest and I'm not the boss. On integrated IT, we do need to do more integrating IT. So the work that is done through NWIS and in the new Digital Health and Care Wales body will, I think, take that further forward. And it's a constant source of frustration for me that we're not able to move even faster. Actually, NWIS has done a range of things during the pandemic that has moved at real pace. That's meant other things have had to take a break. But actually, this is part of unlocking potential. And I do know from very regular views from you and colleagues in primary care that the IT system is a real source of frustration for some people, the ability to do more, what it could do. So, I won't try and tell you everything's fine when you think about it, because I know it could be better. And again, there's some practical work for that new body. That's why it's being created to give leadership and focus to it. And finally, your point about cross-party collaboration, the way that you're working with social care and the way that clusters have really brought people together in a way that's really helpful, not just in the health service, but beyond. We had a parliamentary review at the start of this year, and we agreed a broad approach. We then published a 10-year plan for health and social care together, a healthier Wales. And I just think we deserve some honesty here. We will always have some areas of agreement, other areas of disagreement. And as I said earlier, it's difficult if you're an opposition politician to say that you broadly agree, you signed up to a joint vision for health and social care with a plan to deliver it. That's very difficult to do and to achieve. I actually think that if you watch the Health and Social Care Committee, you'll see an awful lot of agreement between politicians, but you probably won't see lots of that when it comes to the election campaign. But we do already have a longer term vision for health and social care in Wales, and I hope to have the opportunity to see more of that delivered in the next term. But that's the choice of you and a few million other people in the country.
Thank you, Vaughan Gething. Thank you for your time as well this afternoon. The election campaign, of course, will come soon enough. But on those specific questions, Angela Burns, over to you.
Yeah, I'm not quite as rosy in my view of the parliamentary review, I'm afraid, as the Minister. We signed up to it. I had real high hopes for it, but it's stalled. And although there were so many good things that were in it, they've not yet come to fruition.
I think on the points that Arfon was making in terms of the specific questions.
I'm just coming to the points, Owen. So when you talk about having that cross-party formula, you're absolutely right. And if you look at England, they've got a 10-year plan. But importantly, it's also been with clinicians, and it's based around treatment and delivery. Very, very important things, and you need those clinicians on board. You talk about social care and about bringing social care and having more social care workforce out there. That is also incredibly important. We have a very clear manifesto commitment, and unlike the Minister, I'm allowed to talk a little bit more about ours. Our manifesto has already been printed, and you will see in it a line that says we are giving a minimum care wage to bring more people into the care service. We also have a policy called recruit, retain and retrain. I must have said that so many times last night when Rhun and I were on another hustings event. And that is about bringing people in, because we have so many good people out there who are very good at doing the job. And this is about enabling people to come into the service at any level that they can and be trained earn and progress to suit them, whether they are going through the social care route or the healthcare route. And finally, and I know that both colleagues who are sitting here will know this is one of my absolute bugbears on the Health and Social Care Committee, is our IT. I do not understand why we cannot have massive once for Wales IT decisions where we have all the health boards using the same technology. And if you look at a country like Croatia, where they have the most outstanding IT network, where the patient has everything on a card. I turn up in your surgery, I give you my card, you stick it in your machine, and you see everything there is to know about me. My social care I'm having, the treatment I had down in Cardiff, the fact I broke my leg while I was on holiday up in Llangethni, whatever it may be, you know all about it wherever you happen to be, wherever I happen to be. We can knit all this together. It's not rocket science. The technology is out there. There are super bright companies, but we tend to think that because we're good at running the NHS in terms of doctors, nurses, operating, GPs, then we're going to be good at developing IT systems. Well, of course not. That's a speciality subject. We need to get the experts in, and we need to have a really good IT system. And I think that is one thing that could be absolutely transformative in our health and social care system.
Thank you very much, Angela. A sign of things ahead, I think. A sign of the debate ahead, at least. And Rhun, I'd like to again bring it back to Arfon's point about, IT and fairness and parity of esteem and so on and so forth.
This is where I point out that he may be a doctor in Nevin, but he's an Anglesey boy, really. On the points that Arfon raised there, the issues of defined career structures, I think, is really, really important, as well as sort of better pay. To me, our plan for the National Health and Care Service means the integration of terms and conditions and career structures and career paths, as well as pay scales between care and health workers. I think that we've got to do that. We owe people working in the care bit of health and care the respect that they are owed. We've said that immediately we would bring in a minimum £10 an hour wage for people in care. That's not enough, but it's moving towards that parity of terms and conditions for health and care workers that we want to see happening. On the IT, I've been flabbergasted in the years that I've been involved in health and in politics at, fax machines sort of sending things backwards and forward in the 21st century between pharmacies and other parts of the health service. The emergency department at Ysbyty Gwynedd having to, write names on sort of whiteboards of where patients are because the IT isn't up to speed. I'm looking forward to getting to grips with it as a health minister, if I'm fortunate enough to be in that position. I am convinced that we could be doing things in a more joined up, more innovative way when it comes to IT. Goodness me, most of the stuff is available off the shelf. But where we do need to develop ourselves, I know of good IT digital companies in Wales that have developed answers and that not being used by Welsh Government, who still choose to go elsewhere. I think there's so much more that we can introduce that is homegrown, and I genuinely believe that. On the social care beds, social care support, social care capacity, I think we're paying the price now heavily for the loss of community hospital beds over the years. Again, it's down to making sure that health and care work together, because that means budgets work together. Care doesn't get forgotten at the expense, of the more expensive parts of health. National Health and Care Service, to me, is the statement that will be, a declaration of intent of a Plaid Cymru government.
Diolch yn fawr, Rhun. Diolch yn fawr hefyd, Arfon, for that extremely fascinating and extremely important point that are raised, and hopefully the answers have caused you some thought as well. I think that's the end of the public panel questions for the moment. Can I thank everybody who's asked a question? Could I also thank the panel for their time and being open and honest about what happens next. The pandemic, of course, has changed the world. It's changed so many people's lives. It's devastated so many people's lives. And in a way, it will be the defining thing that shapes the discussion as we move on to the next Welsh election. As I mentioned, this is a time like no other, and it'll be an election no other. But, you know, this is a period where the NHS and social care really has proved what valuable resources they are to us as a country and as a society, you know, dealing with the initial crisis, dealing with innovation and research, pushing that ahead. But also we've seen the limitations as well, not least, you know, the age of the estate of the NHS not conducive to to preventing infections within hospital. We've heard a lot of buzzwords today about transformation, about mental health, social care, working together, but in a way, we've heard a lot of those buzzwords before. The challenge is, how does this pandemic maybe frame the discussion in a way that, you know, kicking the can down the road is not an option anymore. Nobody, I think, will envy whoever sits in the seat as the next health minister. But I think, you know, that in the next period will be a very crucial role, more critical than ever. Now, I'd love to say you've been a lovely audience and a great audience, but unfortunately I haven't been able to see you, so I'm taking for granted that you were a fantastic audience, which I'm sure you were. Can I just now hand over to Chris Martin to sum up this discussion and close this fascinating session?
So, diolch yn fawr iawn, Owen. Always a great job for us. Thank you very much indeed. Good afternoon, everyone. Lovely to be with you, and I've thoroughly enjoyed the last hour and a half. So just some quick reflections from me, what I've heard this afternoon, and in particular some comments that we've had in the Q&A chat function. And just so that you're aware, just to remind you that we'll be using some of the information that we've seen this afternoon and heard this afternoon with our partners in formulating some of our ideas as we go forward. And of course, we'll be making sure that the politicians get that feedback too. And although we're looking at tough choices, I think it's very clear that on Twitter, people have been saying there's opportunities too. So don't forget that. Let me just try and pick up some themes then. And I know Owen has also picked up those themes. Big talk about prevention, the importance of prevention. Carolyn Wallace and Daniel Jones, thank you very much. The role of social prescribing and the third sector and community groups. We've got a shining light of community groups here in Pembrokeshire with Solver Care. Joe Ferris from the ABPI talking about new treatments and technology and innovation. Actually, I've seen more innovation in the last 12 months than I have done in my 40 years within the NHS. And isn't it amazing that a vaccine has been produced within 9 to 10 months? Astonishing. Lots of comments about partnership working, the importance of partnership working, and indeed collaboration. You know the themes that have emerged around social care. Can we truly get an integration of health and social care that's funded appropriately and organised appropriately? And clearly we'll see that coming through in the manifestos as we've heard from our politicians this afternoon. Maya Hopkin, thanks again. Inequalities in health, probably heightened, I would imagine, by the pandemic, most definitely. We remember with fondness Julian Tudor-Hart and the inverse care law. Dr. McBritton, I think you're a GP. Talk again, as Arfon did, about digital and virtual medicine. But we had caution in one of the original comments that we had from the Community Health Council. It needs to be combined with face-to-face care. Health and well-being of staff and mental health, a really important theme, and particularly those with long COVID. My colleagues from the Life Sciences have mentioned the role of life science going forward, and particularly supporting prudent healthcare and value-based healthcare as we go forward. We also heard from Lowry Griffiths regarding end-of-life care, the 35,000 people that die, sadly, in Wales, and the importance actually that we talk about it. My family know what hymns I want in my funeral, and we've certainly talked about it. We must encourage people to talk about it. Laura, thank you, Laura, talked about obesity, diabetes and heart disease, you know, this ticking time bomb that we need to make sure that we can look at and address appropriately going forward. There's a question then from David Moore, role of healthcare industry partnership, and from Tamsin around carbon reduction and the health impacts on climate change. All of those so important and the changes that we've seen. So look, bear with me for a few more minutes, if you will. Over the last couple of days, I was wondering what might be in my health manifesto, and it aligns to some further comments we've seen today, as I mentioned in the Q&A function. And whilst today is focused on health, unemployment, the economic recovery, education, housing, etc., all key determinants of health and well-being and impacts on population and health. And let's not forget the Well-being of Future Generations Act. Well, the colleagues in the NHS, social care and third sector have been quite magnificent in dealing with the challenges they've faced through the pandemic. And as we heard earlier, there will be a long-lasting effects. And so my first ask would be to invest in mental health services. We've heard that this afternoon. And the mental health and general well-being of our staff and colleagues going forward. Second, work with everyone. A key message today as well. And I mean everyone, to help reset and recover from the pandemic. How people are treated, involved, engaged, and listened to will be the key factors that will determine how the services recover from the rigours of the pandemic and copes with the post-COVID challenges over the months to come. So let's work across parties, the whole Senedd, and with the people of Wales in true partnership to find the best way forward in the spirit of co-production. We all need to take responsibility for our own health and well-being and be clearly informed of the tough choices we have to do to make things better. But we must transform and not tinker. And finally, I want to quote Calon Lan, written by my great-grandfather. One of the lines is, Calon Lan and llawn daioni, a pure heart full of goodness. And that is what we've seen through this pandemic, a real sense of community, bucket loads of human kindness and goodness. So my last ask is that we invest in our communities to support people in their communities and be good neighbours and stamp out those health inequalities. And if you think someone has gone above and beyond the call of duty, please support our hashtag Above and Beyond campaign and give a shout out to a colleague, health and social care worker, staff in the nursing homes, or a friend or a neighbour. That's hashtag Above and Beyond. So finally, a few heartfelt thank yous from me. To our political colleagues, thank you for supporting our event today. For the lively debate, insights and candour, we are all extremely grateful. Diolch yn fawr iawn. To Vaughan, I guess being Health Minister in Wales is both a privilege and one of the toughest jobs in government. In a pandemic, I'm sure it has been even tougher. Rhun, diolch yn fawr iawn, and thank you for all you do for your constituents in Ynys Môn, and actually for your support of Marie Curie Cymru Lecture Series. Just a plug for Marie Curie there. Good luck to you both in May. And to Angela, a special thank you for your years of public service. We've had many debates over the years discussing health in Hywel Dda. The one thing you get for Angela is passion to make a difference. Now, it's not sure if it's retirement for you, Angela. I'm sure there'll be new challenges facing you post-May, but best of luck in all your future endeavours. Thanks again, all of you. To Owen Clark for being the interviewer extraordinaire. As always, a professional job. Owen, diolch yn fawr I chi hefyd. You are a great friend of the Bevan Commission, and we appreciate your support and wise counsel. And I'm very happy to be your wingman at any time you like. To our panel members today, Jared, Barbara, Sujatha, and Arfon, thank you so much for your thought-provoking questions. Ardderchog, weren't they absolutely great? And to our partners at the Institute of Welsh Affairs, Welsh NHS Confed, Social Care Wales, and the Board of Community Health Councils, we couldn't have done it without you. Great teamwork. And last but by no means least, my Bevan Commission colleagues, Helen, Alison, Hannah, Lisa, Rob, Rupert, Nick, Joe, and Pushby, and my fellow Bevan Commissioners, especially Sir Mansell, who you saw in the video earlier, Baroness Elora Finlay, Professor Camilla Hawthorne, and Dame Sue Bailey, who have supported all three Doing Things Differently events held in the last few weeks. Just to flag up, there will be more webinars and engagement sessions post-Easter and after the election to complete the series. Watch out for details on our website. And finally, from my grateful thanks to Buffoon Media for their technical support. Things will get better. We will find a way to live a more normal life with this virus. And together we can and will make a difference. Thanks again. Please keep safe and well. Diolch yn fawr iawn a hwyl fawr.